Good morning, everyone, and welcome to the second of our digital wearable devices session this morning. I'd like to welcome our three speakers. We have Lucaa Aiello, Dorothy Hardy, and Duncan Banks. Each of our speakers will be speaking for about 20 minutes, and then there'll be 5 minutes for questions after each of their presentations. So with no more ado, I'd like to welcome Lucaa Aiello, who's going to talk about the time inside and the world around, how global events impact our biorhythms. Lucaa is a senior research scientist at Nokia Bell Laboratories. He's a computer scientist working in computational social sciences and how we look at social science aspects through computerization. So thank you, Lucaa.
Thank you for the very nice introduction, and hello everybody, and thanks for coming in so early. All right, so again, my name is Lucaa. I work at Nokia Bell Labs. I am a computer scientist, and as you were saying in introduction, I work in the area of computational social science, which means that we take theories from social science and we try to operationalize them to understand something more about ourselves by trying to implement these in algorithmic methods. The team I work at Nokia Bell Labs is called Social Dynamics, and especially we are interested in a whole spectrum of intangible properties that are relevant to our lives. We study interaction between people, we study the whole area, this is called urban informatics, to understand how people perceive cities and live in cities. And lately we are also interested in capturing intangible aspects around our health and well-being. So especially in the last year, we've been working in a couple of digital health projects. I'm going to present one of those now, and one of those later in the afternoon in the other session. Okay, so let me start with the presentation, and this is basically about stress. Stress is the disorder of the 21st century. It is estimated that 50% of adults in the United States are affected by chronic stress. Of course, stress impacts not only our moods, but also our biorhythms. It impacts our sleep cycle, the routine of our physical activity, and so on. Now, stress is usually caused by our lifestyle, the things that we do every day, our commute, our job, anything that happens in our daily life, on a day-to-day basis. However, there are also some other aspects that might influence our life in terms of stress, which are external events, things that we all experience globally and affect our mood, our rhythms, and our lifestyle. Take, for example, the presidential election in US in 2016. So, in a survey that has been run in August 2017, the American Psychological Association has estimated that the political climate around the election was among the top sources of stress for Americans in 2016. And in a commentary to that study, to the surveys, they say, there is, of course, no way to quantify the scope of mental anguish caused by Trump's campaign, as the stories that we collect through these surveys are entirely anecdotal. Well, of course, it is quite hard to quantify stress in people, especially at large scale. But if you think about it, there are ways nowadays to track the changes in our biorhythms. And specifically, I am thinking about wearable devices. So devices that monitor our rhythms and our health, different signals from our body, and that are always on. So many people wear these things continuously. And the signals that are measured by these devices can be stored in an anonymous fashion and analyzed for temporal analysis of these signals. So what we wanted to do in this specific study is to analyze these traces, these temporal traces, around global events and see how these biorhythms change around global events. So to do that, we used a dataset from Nokia Health, formerly known as Wearable. So you might have seen these nice watches in different stores that they resemble normal watches, but are actually the trackers, are health trackers. So we use data from more than 11,000 users that were wearing these devices in 2 cities, London and San Francisco. You have just a bit of statistics about the average age and distribution of gender. And we collected traces for a whole year for these 11,000 users, for a total of 4 million daily data points. So for every user, we have a daily report which contains the number of steps that the person walked during the day, the sleep duration, so how many hours the person has slept, the time in which the person went to bed, and the average heart rate measured throughout the day. For the people we have in this sample, we have a 90% coverage of days during the year, so it means that at least 90% of the days these people were wearing these devices. Okay, so it's a pretty dense coverage. Now, given this data set, we focused on 3 different aspects or metrics: volume, rhythms, and synchronicity. I'm going to explain them one by one, but the reason why we focus on these 3 different aspects of the signals that we're measuring is because in previous literature, in psychology and also in medical literature, these 3 metrics related to our rhythms have been related to presence of stress. So basically, when we're stressed, these things are disrupted. And so this is what I'm going to show you now. So let's start from the volume. For example, how many steps a person walks during the day, right? And here we perform an aggregate analysis. So we average all the number of steps for all users over the year, and this is what we get. As you can see, the curve is quite noisy because the spikes that you see correspond to the weekly periodicity of people, right? So people walk less or more during the weekend, for example. Now, what is also quite evident here is some very low minima that are around January here, which are quite probably easy to understand and interpret, because one is on December 25th, the other one is on January 1st, and these, of course, correspond respectively to Christmas and New Year's Eve, right? So during these festivities, people tend to walk less, and this is quite expected, and adds some validity to the signal that we're studying. So nothing really surprising here, okay? Now, if you look at sleep instead, so numbers of hours slept by people in the sample, again we see this very sharp, very clear weekly periodicity. People tend to sleep more during weekends, but also we have other minima that are not super obvious. So here too, so one, it is in June 2016, and the other one is in November 2016. Which correspond exactly to 2 events that are not recurring events, but maybe especially for the one in June 2016, do you know what happened there? Do you have any guess? Brexit, exactly, yes. And the second one is, as I was mentioning at the beginning of the presentation, was the Trump elections. So also here, it's quite intuitive a posteriori, because people were, sleeping less, staying up a bit later to watch the results of the election, right? And so they were a bit sleep deprived. These effects are very localized. So people slept less only during the night of the election, okay? However, these localized effects does not hold for all the signals. For example, if we look at the average heart rate during the year, this is what we experience, what we see. We do see a very sharp increase from roughly 70 beats per minute in terms of heart rate to almost 74, again around this time, which is the Trump election. Okay. So this sharp increase, it's a one-time increase during the timeline, and so we started asking ourselves what might really be the cause of this, right? So to explore this aspect more, we separated the signal between US and UK. As I told you before, we have two different cities, San Francisco and London. And what we can see here is that for US, the increase is much bigger, and it peaks exactly during the election day. Now, to rule out other confounding factors that might have caused this increase, we checked other things. So, for example, the presence of new users. So, if new users are added to the sample, it might be that these new users skew the signal, and therefore maybe the heart rate increases. But this wasn't the case because we always monitor the same set of users throughout all the year. We checked also for increased activity. Maybe heart rate increased because people run more or walk more, but it wasn't the case. We did check for software updates, so basically the way in which we monitor heart rate was always the same throughout the year. And also we check for temperature. Heart might be beating faster because of lower temperature, but there were no significant difference in temperature, right? So basically, by ruling out all these confounding factors, our main conclusion is that we do have a quite strong evidence that this major political event has something to do with the increase of heart rate. So if we want to summarize this, a little Trump fact. So the hearts of Americans started beating faster in the days leading to Trump's election, and they took months to get back to normal. Now, we didn't stop at studying the volume, but also we studied rhythms, which are very important for our daily lives and the cyclical patterns. So what do I mean by rhythms? So if you take a look, for example, at this example diagram, which plots the number of steps a single person has walked in 1 month, in 4 weeks. Okay, as you can see here, just looking at it, you can see very clearly a weekly periodicity, right? So going up and down 4 times during the month. Now, from the algorithmical point of view, what we can do from this signal is to extract automatically the weekly periodicity by applying what is called the Fourier transform. So we take the signal in the domain of time, and we transform it in the domain of frequency or periods, right? So as a result, we have a plot like the one at the bottom, in which the peak of that plot represents the dominant periodicity in terms of number of days. In this case, it's 7, right? Because the periodicity was weekly, okay? Now, to see how much a periodicity of a person, for example, in the number of steps or even in the number of hours slept changes, what we do is we take the same population before and after the event, and we measure the peaks, the nominal periodicities, for every single person before and after the event. Here we consider 1 month before and 1 month after. Then we do the difference between the peak before and the peak after, so the shift in periodicity, and we plot the distribution of these shifts. Right? And then we compare the distribution of this shift with a distribution which is expected in the random case, basically in any random day. So this is the result. So on the left, what you can see is the distribution that I mentioned of shifts in rhythms for sleep, for example, for Christmas, around Christmas, compared to the random case. So here you have 2 curves which are very much overlapped one on another, which means that Christmas doesn't introduce a shift in rhythm more than what is expected at random. So there is no shift more than what we would have in any random day. However, on the right, if you look at the US election, what you can see is that the 2 curves are quite shifted, are quite different. And this can be measured with a measure that is called the KL divergence, which measures the difference between 2 distributions, or 2 curves, which is 7 on the right and just 0 something on the left. So we conclude here that around the US election, unlike Christmas, for example, there is a big shift in rhythms for the sleep. And the same thing can be noted for heart rate. You have Christmas on the left, US election on the right, and the two are quite different in patterns. So to summarize, also here we say that in the month following the Trump election, the natural cycle of sleep and heart rate were heavily disrupted, and this can be seen also for Brexit and so on. So the last the metric that we look at is synchronicity. Synchronicity is the tendency of people to do things at the same time. For example, take sleep, right? So we have 3 people here, I, J, and K, and we have the time these people went to sleep, they went to bed. Now, we say that I and J are quite much synchronized because their sleep time is more or less the same. So their out-of-sync score, as we call it, is close to 0. On the other hand, K and J and K and I are completely out of sync, so their time for bed is completely shifted, and so their out-of-sync score is going to be close to 1, all right? So we do use this measure, and we apply it to the sleep time. Now, basically what we do is we take a time window around the event, for example 1 week, and we plot the distribution of these out-of-sync scores, and that's the distribution we have. From this distribution, we extract 2 values. One is the average out-of-sync score, so in the average in the population, and the second one is the volume of people who are in the tail of the distribution, which are basically people who are heavily desynchronized from the other people, so people who go to bed at very weird times. And now again, what we do is we take the event, 1 week before, 1 week after, same population, and what we do is we measure the delta in, here is very small, sorry about that, delta in the average out-of-sync score, and delta in the percentage of people who are highly desynchronized, to see how these values grow. These are the results, so in terms of synchronicity disruption, on the left we have the delta in the average value of out-of-sync score, on the right you have the increase in the percentage of highly desynchronized people. So what we see here is that in the random case, we do expect basically no variation. And around all these events, except Christmas actually, the increase is much higher, especially for the US election. The last bar on the right, for example, means that around the US election, after the US election in the week after, 30% more of people started sleeping at very weird times, very desynchronized times with the general population. So if we want to summarize this, again, in the week following the Trump election, the number of people going to bed at very unusual times increased by 30%. Now, if you put all these 3 metrics together, what you can do is actually to generalize this a little bit and run some event profiling. So if we take every single day in the year, right, and we plot these days in these quadrants that have volume on the x, so shifting volume, so for example how much people sleep more or less, and rhythm disruption on the y-axis, so how much the rhythm is disrupted, and we plot this for sleep, steps, and heart rate, we can see cluster of days. Here every day is a single dot, and the colors represent different clusters of days that are extracted automatically. Now, first thing is that you do have very clear cluster of points, so which tells us that we really can categorize different events according to these shifts in rhythms. But also another important thing is that, for example, if you take here New Year's Eve and US election for the sleep, you see that in terms of sleep deprivation of the volume, they're more or less at the same point. But if you look at the disruption in rhythms, these 2 things are very different. So if we look just at volume when we describe these patterns, we are basically missing out something. We miss differences. So we need a whole family of metrics to describe properly the impact that the event have on our biorhythms. All right, so as a summary, what we did is we show that it is possible to use health monitoring devices to monitor biorhythm changes in a cheap way, as these devices are already basically deployed. We show that changes measured by these devices around major events, such as political elections, are not only instantaneous changes, but also longer term, like the heart rate, like the rhythm disruption, and so on. Also, we propose this new family of metrics, so these 3 different metrics to track those changes, not just in a single day, but over time. And basically, the hope that we have is that given this family of metrics, we could start using in a more systematic way wearable devices as new health surveillance tools. And hopefully, after being able to monitor all these changes in rhythms which might reflect the stress of people, we will be able at some point to also deliver interventions that will be able to relieve a bit of the stress on the shoulders of people. All right, so before concluding, I want to thank my 2 collaborators, Daniele and Eva at Nokia, and of course, thank you guys for the patience and attention. I'm here for your questions.
Thank you very much, Lucaa. So do we have any questions? Do we have a microphone?
So hi, thank you. That was a really clear presentation.
Thanks.
So I just wanted to go back to your wearable. I know that so just to clarify, so this was the watch, was it? That you had a picture of the watch. Could you just tell us a little bit more about the wearable itself? And also, in terms of you monitored in different cities, and so what consent do these people give for you to analyse their data?
Yeah, sure. So in terms of the wearables, it is a mixture of wearables. So one of those is the watch, which is a watch that measures, for example, all the signals that I've mentioned, so sleep, steps, and also heart rate, right? Because it monitors the heart rate. There are other devices, for example, blood pressure monitor that also monitors heart rate, and those data are included as well. So it's a mixture, so it's a family of devices, and we aggregate all those just to have a sample of people who are very much covered in terms of days of monitoring, right? So we aggregate a signal from different devices. Now, in terms of the consent, so all the data that we measured have been measured at city level. So basically what we do have is an anonymized identifier for the user and just the city the person is in, right? And then the traces for sleep and steps. So all people who are included in this data set, so their traces included in the data set, are all people who consented to research studies with their data, right? So the sample is also rather small for this reason, but basically, yeah, so there is consent from the users, and also the data itself is processed in an anonymized manner, so there is no way for us to understand who the data was from, yeah.
Thanks. It's really interesting, but how do you think it will be useful to know about doing this sort of study and how people are affected like this?
Sure. So, as I was mentioning at the beginning, so far, nobody, I think, for what I know at least, has managed to measure impact in terms of stress that people perceive at this scale, corresponding to global events and different events, right? Now, the usefulness of this approach is that we do propose a set of metrics that are very general and are not just related to, for example, Brexit or U.S. elections, but in any day, if you have this anonymized pipeline that can monitor the rhythms of people, you can real time say, oh, look, this population is stressed, or its rhythms are being disrupted in a sense, right? So it's the first step to monitor health at scale, and on top of that, eventually deliver interventions. Now, the question is, which those intervention would be, that's an interesting question, right? So once we know that people are stressed, how do we relieve stress? And that's, of course, will be the next step. A very interesting question. I don't have an answer as of now, but yeah.
And we've got time for just one more question.
Okay. Yeah, just on the, well, I'm going to combine it into two questions, actually, Verena, sorry.
Yeah,
anyway, with regard to stress, I'm just thinking that with regard to the Trump election or Brexit, some people might have been experiencing intense pleasure rather than stress. So I'm just wondering your comment on that. But with regard to the monitoring of various vital signs, if you like, around sleep and blood pressure and so forth, I mean, you monitored over a whole year. For a hell of a lot of people. Was there some provision where particular increases in stress or exacerbations in relation to blood pressure or things that might be medically important, was there some provision to actually identify such situations and alert somebody, or indeed alert the user themselves of that particular situation?
No, sure. So yeah, regarding the first question, I think that probably changing so here we have London and San Francisco, right? So San Francisco, of course, is probably a city that wasn't really, for the majority of people voting for Trump, right? Which might be a factor here, right? So extending these to different samples of people in different cities would be a way to figure out better which segments of the population were more affected. On your second question, of course, it's an excellent point. What is missing from this study is the clinical counterpart. So we don't have reliable ground truth to say, oh, in this population, people, for example, consume more drugs related to, anxiety or stress, right? So this is something that we cannot really do because we don't have the spatial granularity. That would be needed to do that because we know just the city that the person lives in. If we dig more into the spatial granularity, so for example, you would know the borough the person was living in, the way to do that would be to look into public data for medicine prescription, for example, which is something I'm going to talk about this afternoon. And then you could have a ground truth of clinical, basically, data you could match these traces with.
Thank you very much, Lucaa.
Thanks. Thanks.
Lucaa's around all day, so if you'd like to follow on any questions, then do please ask him. So thank you very much. Our next speaker is Dorothy Hardy, who's going to talk on sensing and illuminating textiles with electronic yarn. Dorothy is a Senior Research Fellow in Electronics Textiles at Nottingham Trent University. She has an interesting background in both engineering and art, so she's perfectly placed to be bringing these electronic yarns together into textiles. Thank you, Dorothy.
So yes, I've brought some bootlaces to tell you about, to cut a very long story short. These are the electronic yarns, so I'll give a chance for people to handle them afterwards. Let's see how this works. Okay, so Lucas talked about monitoring using a watch. I'm going to tell you about electronic yarns that can go inside textiles so that you can have your sensors or illumination or even whole pieces of circuitry anywhere on the body within textiles without being able to feel them. So to give you a bit of background, I'm from the Advanced Textiles Research Group at Nottingham Trent University, which is run by Professor Tilak Dias, who is Professor of Knitting, which is the most fantastic title. So he has specialised in things like scan to knit, very technical knitting, where you're almost 3D printing with knitting. You can vary the materials you're using, the pressure you're putting on certain parts of the body. So there's one example of that in a collaboration with Stoll, the knitting machine manufacturer there, this is a balaclava that heats the air as it goes into your mouth, so you can go running in cold weather without that horrible feeling as the cold air enters your throat. Electronic yarns are what I'm going to tell you about, and there's a little image there of a pinhead pushing towards a blue illuminated LED within an electronic yarn. And the group also specialises in flexural composites. Basically, we have rooms with warnings on the doors saying, do not go in here if you're easily upset, because it looks as if there's a dead body in here that's being operated on now. And it's not. It's a film special effects dummy made up completely realistically, and Richard makes artificial organs to put inside which can pump blood around and inflate if their lungs, so that surgeons, people working in the field can have a very, very realistic experience of dealing with quite major traumas. His main dummy usually has its chest wide open. It's called Tony. So our labs have testing facilities, which Guyane is showing on the right here. She works on treatments for lymphedema, so that you can vary the pressure on swollen, usually limbs, and she's working on things that patients themselves will actually be able to vary, so that you're not just having to have one big thing put on you by a clinician, but you can go, right, this is the pressure I want now, this is how I want to vary things. Carlos on the left is working on one of our big knitting machines. We do all sorts of things with these. We put copper through them, we generally hack them, and get them using different materials and making various structures the way we want. So there's this amazing vision for smart garments. They're going to be able to measure everything on us, feed back to us, talk to us, and we're perhaps going, in this talk, I'll show you how we're going one little step towards this. And I'm also interested to find out, because there are pluses and minuses of this. We can fill garments with electronics now, no problem. That's something we can do. But do we want to? What's going on here? So my answer is the bootlaces that I told you about on the first slide. So I've got an illuminated one here. Let's just get it to light up. So we've already had Father Christmas, so I think you should have some Christmas lights now in the presentation. So I hope you can see the lights on there. So that's one of the, it's a completely flexible yarn. I've got it connected into a big circuit board there. It doesn't need anything that large, and attached to a battery. So you can see LEDs in there. But these yarns can contain any small sensor that you want. And thanks to mobile phone technology and many other types of technology, sensors do now get ridiculously small. And we're working on a project with the University of Southampton where we put whole flexible pieces of printed circuitry within the yarns. So in the spirit of Kerber's supermodels who feature in Private Eye, they're characters who are just like pieces of string. I've drawn the electronic yarns so that you get a feel for a sort of empathy with them. So they're all saying hello there and pointing out. I've got a magnified picture of a real one in the centre there, and you can just see the little bulge where the sensor is. I think I've got you a thermistor in there. So temperature sensing is what that's about. And the further good news, because it used to take about half an hour to put one sensor in one yarn, is that we've now semi-automated the process of putting these in, which is a great step for a lab in a university. So we now have a process of, I've shown this with an LED on the top here, where we take the LEDs, that one measures 1 by 0.5 millimetre by 0.3 millimetres high. We use a pick and place machine and a robot, and we solder them onto copper wire. So we're sort of starting to make a circuit, but we've ditched the base of the printed circuit, which is where it gets really tricky, because you're suddenly working with a flexible piece of copper wire and using various textile techniques to control that. And you're doing electronics and you want things soldered where you want them and precise. So we put the LED on the copper wire, then we encase it in resin. It needs to be moisture proof so it can go through the wash. It needs to be knock-proof, especially before we then stuff it into what's called a small diameter warp knitting machine, which is basically a bootlace maker, which covers it in this knitted sheath, which is, at the moment, we've got these down to 1 millimetre to 2 millimetres width. As we progress, at the moment we're using package dies, which are quite fat, basically 1 by 0.5 millimetre. It's quite a big thing to put in there. We can progress to using smaller dies, so there are possibilities of making this even smaller. So at the moment we've got quite a fat textile yarn, but there are possibilities of making something quite fine and thin to go within anything from wound dressings to standard pieces of clothing to expedition kit. And yeah, there's a picture of the LED yarn to give you an idea of what's happening. There's a paper due out in May in Rome at the DTIP conference, which will give more details of the automated manufacturing process. If you'd like to find out more about that, you can also just ask me. I can send you a preprint if necessary. So, although I'm talking about sensors, the way we advertise these electronic yarns is by putting LED versions, light-emitting diodes, into them so people can see they're there. The trouble with our normal yarns is they're very small and thin, they fit well inside a textile, and if you take them to trade shows within something, people can't see them, which is the idea. So we've made some versions. Bonnie Binary has worked with us to make this beautiful illuminated dress, which is really just advertising the fact that it's possible to move and even dance in a garment made with these yarns. And we've also put some into automotive upholstery. At the moment, when you make a car, you fill the interior with fabric, and then you click on masses of plastic and electronic things for interior lights here, sensors there, and so on. If you could put the electronics within the fabric, then that could reduce the amount of materials used quite significantly. It could make the interior much simpler. So this is one example, and there's a student called Rachel White-Reed. If I get, no, I've not got her surname right. Ask me later for more details, again, if you want to know more about this. But she's working on this application. So, but back to the sensors. So the big thing about electronic yarns is that they can incorporate sensors. So we put some into socks. So you've got a fairly standard, reasonably flexible sock. And inside the foot of this one are 6 yarns containing thermistors, temperature sensors. And this could be used for monitoring what happens with non-freezing cold injury. This is basically the borderline between having cold feet and frostbite, and the effects can be permanent and very nasty. So the idea is that these could be used, say, by the military or by expeditions to monitor what's happening on the foot. The sensors in the sock are reasonably close to the skin. They're still, the fact that they're encapsulated and within a yarn means they're not absolutely touching it. So Theodore Hughes-Riley and Pasindu Lagoda, who've been working on this, whose paper I've put at the bottom, have been testing and calibrating to find out what's the temperature difference, how well are we measuring. And they've discovered that the level of measurement, there is an offset, but it is good. So the thermistors are responding well to what the temperature of the foot is. So this is promising. And you could, the feedback can be via Bluetooth device. It's not fast, but you probably don't need an instant feed out for this sort of thing. So there are all sorts of monitoring possibilities here. And we've demonstrated in a sock, but this doesn't have to be, obviously, in that type of garment. This could be used for measurements anywhere on the body, or even within architecture, which is another possible application. One other application is in vibration sensing. This is a slightly larger chip, so the electronic yarn that contains this is within the palm of this glove, which is exactly the point, if you're using a pneumatic road drill, that would be where the forces would be coming through your hand. There's a legal requirement to measure how long and what sort of frequencies workers using this type of equipment are being subjected to, because it can lead to, again, all sorts of horrible illnesses, carpal tunnel syndrome, vibration white finger. But the trouble is, it's very difficult to monitor. If you're a lorry driver, the amount of time you spend in the cab and actually driving is very carefully monitored. For someone working on the road, they'll be like, yeah, I used the road drill today. Oh, I forgot to write it in the book. All that sort of thing can happen. If someone has a pair of gloves that they have to wear when they're using particular equipment, it's possible to start to build up a data bank of material about what's happening. And this will need to be a feedback loop. Again, a bit like Lucaa's study. It will be... we'll need to find out what types of frequency are most recorded and what's happening to workers when they're actually reporting any sort of stress or pain. And there'll need to be quite a bit of work done on this. But for sort of safety and well-being, this is looking good. One other application, this is Pasindu Lagoda, Mr. Thermistor, but here he's monitoring, he's wearing a helmet that contains microphones within the helmet cover. This is for military personnel, it's for monitoring the amount of sound that they're receiving. If there's gunshot nearby, obviously that can damage hearing quite significantly. Once you can get a microphone into something small, like a yarn that can be put inside the cover of a helmet, which is a knitted structure, then that you could monitor very close to the ear and pick up what's happening. There was some concern once you've put these tiny microphones within a nice big blob of resin and stuffed them into a yarn and put them into a helmet cover, will they still work as well? Basically, the conclusion is yes. And there is some work just about to be published on this. Okay, so it's all right to have these yarns, but they've got copper inside, which is non-stretch. So we decided to stretch them to the limit and to check literally what happens when you put these on stretch material. If you want to monitor close to the body, you really want a nice stretchy material to have them on. So we went all out. We had funding to work with Nottingham Carnival and various other carnivals. We had Gil Santos from Brazil. We had a fantastic team of theatre designers, and we went to town and we put electronic yarns onto the legs of a stretch unitard and built up a huge carnival costume, and then said to Gilles, how does it feel? Can you dance in this? And he could. So we had to work on our embroidery technique. We discovered that we needed a zigzag pattern of embroidery to accommodate these non-stretch yarns on a very stretchy material. We used a 10% lycra. We had masses of problems with connections. If you want to talk about them at length, then get in touch with Victoria Shakalite at Huddersfield University, as she is now. And we learned a lot, and it was an extremely useful project to prove that, yes, you can monitor on the body, or you can have an electronic yarn on the body, I should say, without that being something that's upsetting or getting in the way as you even dance throughout a carnival performance. So we move on to acceptance of electronic yarns. We're talking about putting these inside clothing and monitoring even more intimately than having a watch that you can take off. the question is, what will the reaction be, and how will we ensure that users really want this to happen? Our current work's been on applications, say for the military, where people can be told what to wear, or prototypes which have not yet gone through trials with users. So I think the exciting question here, and it's sort of my open question to the audience as well, is how will we make this technology useful and something that isn't reacted against by throwing leaf balls? And of course, the other question is, how do we balance? We may be able to monitor and assist through quite difficult illnesses or prevention of illnesses such as vibration white finger or carpal tunnel syndrome. But how do we ensure that we're making textiles where you can then remove the electronics? Once you've put the electronics inside a yarn, it is possible to pull the yarn out. They can be fitted through embroidery by couching or satin stitch over the surface of the yarns. They can be put within channels in knitting or within weaving, but we then need to assess what's the way up between using these yarns and the benefit and how we get them out again afterwards, so that we're not creating some horrific waste stream with lots of possibly medical grade clothing which contains electronics so well embedded within it that it has to go to landfill. So thank you. Any questions?
Thank you very much for the talk. So, just a curiosity. So, which is the killer application in the consumer market that you envision for this stuff? So, a thing that really, I mean, you showed the very specific use cases, very nice and very useful. But, you know, for the average Joe of the situation, well, what's the sort of product you would see like being disrupting the market in the next 10 years?
I think it might be wound dressings. At the moment, you put a wound dressing on, especially for people who have chronic problems with wounds, and you don't know when to take it off. You sort of need to check if things are going okay, so you take it off, and that can be absolutely the wrong time. If you can monitor temperature, say, within a wound, then you've got the chance of finding out if things are becoming infected or if everything is just nicely stable. Even more interestingly, if you could monitor levels of moisture, you could work out exactly what's happening, or at least a bit more. Ideally, you'd have a camera in there. But it's this, again, if we can get everything really small, then we've got the chance of making stuff that can go inside the wound dressing and measure without interfering with the wound. And I think that could be really exciting for some applications. And the sustainability difficulties of putting all this inside a wound dressing could really be offset by the fact you would need less doctors and nurses visits. And I think people could start to feel like, I know what's happening there, I'm a bit more in charge.
Yeah, thank you very much, Dorothy. That was a delightful presentation, actually. And well, first of all, just on the wound dressings, I think you're probably on the right track there, because you don't necessarily need to have the sensors and what have you embedded throughout a whole fabric. It might be very localized, and which obviously starts to answer your question about landfill and environmental issues, if things are dealt with in smaller sizes, and you can gather the information that you want. Goodness, where do I start? I've got a thousand questions. I shall home in perhaps on one, and it responds to your last point about the acceptability, and perhaps a fundamental question as well that your talking dress asked in one of your earlier slides about, you know, washing and things like that, the fabrics and so forth. But the last one was more or less about wider usage and wider applications, and also acceptability, which also related to one of your slides. Would people want to wear smart fabrics of this kind? And I think the answer is people will be very, very skeptical, and certainly is premature to think in those terms just now. But again, smaller things, you know, on a wristband and things like this, or I think huge opportunities here. I'm looking forward to seeing how this all moves forward, and I hope you get some more funding to keep it going.
Thank you.
And our final question.
Hello, thank you for the interesting talk. I saw most of the prototypes you showed in Excel last month. In person, it is as amazing as it looks in slides. My question is about batteries and how do you power them? Because from my experience, I know when you design small electronics, then batteries are usually the biggest part of them, and it's a huge problem. So how did you solve that?
Yes. Each one needs batteries. We've managed to get this. We're mostly working with the various types of lithium polymer ones. I've got the size that we use in the dress in here. So that must be about 10 by 6 centimetres. So it's not insignificant. It's all about how much power do you want for how long. But yeah, I would completely agree. Batteries are the big thing. There are various companies talking about flexible batteries. I think for me, the main thing is safety, because lithium polymer, you've still got the explosion risk. And once it's on body, that is a really big deal. And people are walking around, I mean, I've got a coin cell on my wrist now. That seems to be okay. But once you're talking bigger stuff on different parts of the body, it all starts to feel different. So, yeah, I don't have the answers. We keep looking out to see what's going on. But it's the big thing for these, yes.
Thank you very much, Dorothy. And Dorothy is around today, so do ask her more questions during our various breaks. So thank you very much. Thank you. And our final speaker this morning is Duncan Banks. He's going to be talking on the role of activity monitors in active and healthy ageing, perspective of healthcare professionals. Duncan is from the Open University. He's the Director of Work-Based Learning here at the OU. His background is in medical physiologist. He interestingly has a PhD in anaesthetics, and he's been working in wearable technologies since he was 16 years old. And his big claim to fame is that he was involved in doing the first implantable wearable device for human deep brain stimulation back for Parkinson's disease in 1986. So thank you very much, Duncan.
Okay, thank you very much, Verena. Welcome everyone to this amazing meeting. I've learned a hell of a lot in the last few minutes, actually. The first slide is an introduction to what I'll be talking about, ageing population. So an ageing population, retaining independence of older people, support given to carers, the use of internet-enabled technologies to transform healthcare services are some of our national concerns. We've been conducting a research programme in collaboration with Age UK, Milton Keynes, Carers MK and the University of Oxford to investigate whether and how wearable activity tracking technologies can contribute towards monitoring of activities and health by people aged over 55. The example technologies that we've been using include off-the-shelf activity trackers such as Fitbit, Garmin and Samsung, and a variety of wearable smartwatches. Okay, so here you have an example of an activity monitor. This is one of the Garmin's. You also see there Microsoft band, now defunct, showing you what is capable of recording in terms of activity and where you've been walking and so on. You see we're looking at recording the activity tracking and using apps and also training people to use dashboards of the apps in order to record what they've been doing. And the sort of things that they've been looking at are, I can't see it on here, unfortunately. Hold on a minute, let me just get that bigger. Okay, daily activity, heart rate variation, steps taken, including where people have been walking, sleeping patterns, and a variety of things that they've entered, such as water intake, skin temperature, perspiration level, and a variety of other things, floors climbed, for example. Most of the activity monitors that are being marketed are really destined for people who are young, fit, healthy, and the adverts show that. So our concentration was really on those people over the age of 55 and see whether these trackers could be useful for health reasons. Although we have focused on activity trackers in our research, our underlying aim has to be determine the service design requirements for people over the age of 55, their carers, and people being cared for. And this example here is showing a Samson Gear 3, looking at the number of steps walked and the amount of activity during the day. So in general, most of these are destined to try and improve someone's fitness or activity levels and for managing specific medical conditions, such as those related to heart and respiratory system. Being fitter not only benefits the individual, it reduces society's need for social care, and the value to society of even a modest improvements in fitness could be several £billion a year. Since the mean care needs of a person almost doubles between the ages of 65 and 75 and triples between the age of 65 and 85. So the strands that we're looking at, research strands that we looked at in people over the age of 55 included socialization and loneliness in people in Milton Keynes, digital skills of people aged over 55 years, and health monitoring for older people, and we'll concentrate mainly on the health monitoring for older people, carers, and people being cared for. So we've had a long history of working with a variety of charities in Milton Keynes, including Age UK, Milton Keynes, and Carers MK. And essentially we've used these contacts to obtain participants, and they've been actively involved in the recruiting process and also as part of the research plan. So we're very thankful for these people being part of our research. Okay, so research objectives include active and healthy aging, alleviating social isolation, self-management of health, self-monitoring and monitoring by carers and of carers, actually. It came to our attention that being a carer is quite stressful, and there's a high probability, if you're a carer, eventually to suffer the same problems as the person you're caring for in terms of socialization and so on. And our funding timeline included obtaining money from Sir Haley Stewart Trust and ESRC Impact Acceleration Award, which runs until next month. So this is our stakeholder map of the research we were doing. We were part of the SRCIA project team. We had end users, people over the age of 55 who are training the devices, and also carers. Professionals, we involved professionals in assessment of the usefulness of these devices, including geriatricians, GPs and surgeons. And also we involved Samson, Semiautomated, Active Insights, Mycor, and a few other companies. Samson were our major industrial sponsors. As I said already, local charities. The Community Public Health Directorate, Older People Partnerships Board, and MK Cardiac Community Group, and universities of Buckingham, Oxford, and the Open University. Seems to be unresponsive, the keyboard. Okay, oh, here we go. Let's go back. So our approaches were to use surveys, interviews, workshops, presentations, and environmental scanning and reporting, and create a structure so that we were talking the same language. So our research methodology, we had for age ranges from 18 years and over, particularly for carers and those being cared for. We had 245 participants, 518 participants of age 55 and over, 74 carers, and in particular, in the focus of this talk, 84 healthcare professionals. A variety of workshops, as you can see here, And in particular, we had interviews of 12 healthcare professionals to look at the feasibility of using these devices for healthcare monitoring. So we conducted face-to-face interviews, and you'll also notice that we've got posters available in the atrium of the library if you're interested in more. Okay, so in terms of self-monitoring, number of walked steps, the distance walked, recorded data over a period of time, looking at heart rate variation, heart conditions, lung conditions, and Parkinson's disease, the variety of things that our participants were interested in monitoring. And also many of them monitored their own blood pressure, their blood sugar level, and were very concerned about whether or not activity included measuring gardening and a variety of other things. Also, in terms of awareness, they were conscious about activity levels. They wanted to know about health. They wanted to have the ability to have informed decisions about their activity levels and diet, raising questions to medical professionals, and in particular, they're concerned about data privacy. In terms of socialization, many of these devices are proposed in the future for social prescribing, using the activity monitors together with other people. We noticed at yesterday's talk that was quite a common requirement for some people. They had concerns, however, about sharing data with others and also challenging friends to do activities. When we analysed the results of our surveys, many of the people over the age of 55 were looking at recording the number of walked steps, distance walked, recorded data over time, heart rate, sleep patterns, calories burned. So many of them were looking at the same things as the younger generation were concerned about. But when we've focused more on monitoring, you have two things that they were concerned about. One was fitness. They wanted to be more conscious about activity levels and whether or not they were becoming more active. They, as you age, are more conscious about your health and lifestyle, and you really want to feel more fit. In terms of medical conditions, those with medical conditions, they wanted to improve their medical condition, whatever it was, by being more active. In particular, many of them had heart conditions which they were looking at monitoring, or lung conditions. Several of them had COPD, for example. And one or two of them had Parkinson's disease. And as you probably know from Parkinson's disease work, looking at activity trackers, there is a thought that looking at recording activity and monitoring it, encouraging people to walk, leads to a slight improvement in that condition. So what were the ways, what influenced older people to use these monitoring devices? Many of them were more conscious about activity levels. They wanted to know how active they were compared to their colleagues. They certainly became more active. It was an incentive to become more active. They're much more conscious about health and lifestyle. So being part of a group, for example, was very important, sharing ideas, the importance of knowing about diet, walking groups, gardening groups, and so on, although many of these trackers don't actually do non-conventional monitoring of activity. They thought that was a bit of a shame. So what kept them motivated to choose using this device? You can see there, most of them wanted just to monitor their activity, to maintain health, or to improve health, and monitoring how their progress was in terms of a health condition. So we surveyed 518 people over the age of 55 and about the types of monitors they were using and the motivations to acquire and use activity monitors. And most of them found it helpful to monitor their own activities. As you see here, they wish to maintain their health, they wish to improve their health levels, and also be able to see how they progressed in their activity levels. So specifically healthcare professionals, the areas of research that we concentrated on was basically the well-being of the users, the role in prevention, treatment and rehabilitation, the challenges of recorded data, the ethical implications of the data, and the adoption barriers. Many of them were rather concerned about the fact that this was going to add their burden if people were to present their data at a consultation, for example. So that's something that needs to be sorted in terms of presenting someone with data in a 8 to 10 minute session. So these were the concerns of the professionals. So the survey of 84 healthcare professionals, we asked them about their concerns regarding activity monitors. The reliability of using the device over a long period of time, 83% of the respondents said they were concerned about the reliability. 55% of the healthcare category said that they were concerned about the accuracy of the recorded data. Obviously, everyone's concerned about that, so it's somewhat universal. But when you're looking at monitoring, or in fact looking at changing someone's medical regime and seeing whether that has an effect on their activity levels, you need to make sure that the data being recorded is accurate, and that is a finding of our study. Also, the data in terms of interpretation of the data needs to be very simple for your doctor, your GP. And obviously, there's also aspects of ethical accessing patients' data. I don't really have so much of a problem there. You should be willing to share your data with your GP, but it needs to be in a way which the GP can understand and perhaps enter that information in a meaningful way. I'm a somewhat nightmare patient when it comes to my own GP, because I sometimes say, are you interested in my blood pressure measurements or activity levels? And my GP would say, well, yes, but is it relevant for this discussion? And it's almost deflates me at times, it really does. Okay, so how can these activity monitors have a role in the physical health and well-being of individuals? Well, firstly, in the prevention, i.e. for staying fit and as a preventative measure towards medical conditions. There is certainly evidence that increased activity levels for someone who is pre-diabetes will prevent the occurrence of, say, type 2 diabetes, or in fact, if you have just been diagnosed with type 2 diabetes, increasing your activity levels and monitoring this using these tracking devices can actually lead to an improvement in your medical condition. Also, we've come to use this term prehabilitation. You know about rehabilitation, or prehabilitation is before you go into have an operation, you become physically fitter to endure the traumas of having an operation or whatever. It's certainly been proven that those people who are actually more fit have a much higher chance of having a successful operation, whatever it is, knee operation, hip injury, hip operation. Obviously, this is all planned surgery. And those people who are fitter withstand the stress of surgery much better. So in the next category is rehabilitation. These devices have been used by the health care assistants and doctors for monitoring of activity during rehabilitation following surgery. So you give a patient a list of things they need to do and a time which they do it, and that actually aids a recovery from knee surgery, the surgeon that we were talking to, knee surgery, and certainly hip surgery. And that's quite different from the advice given 20 or 30 years ago when you had to rest for weeks on end, but actually that resulted in a much worse prognosis for those individuals. And regular monitoring for mobility suffering, those people suffering from medical conditions, very important. So in terms of the role of activity monitors in physical health and well-being, so educating patients, we found that was an important aspect of people's reactions to the surveys and interviews. Part of the diagnosis, it could be useful in the future for diagnosing certain medical conditions. I won't go into that detail now. Monitoring, regular monitoring, devising exercises and, as I said earlier, routines from following surgery. Also, it's important in some cases, particularly those people with, say, heart conditions, that they enter data themselves that they've recorded, like, for example, water intake, and weight loss. So you're combining what you'd normally do with what the activity tracker's recording. And we found this to be a very useful thing when considering medical conditions. So this is one of the, this is a healthcare professional looking at the role of activity monitors in physical health and well-being. I think when you're 55 plus, you're generally susceptible for all the age-related diseases, aren't you? Probably when you retire, your lifestyle does change. I think that this is a great way for the older person to know what they're doing, that they're doing enough exercise, and that generally all things are well. Now, in terms of research impact, raising awareness about activity monitors certainly has come from our numerous publications. Educating older people, carers and people they care for, and healthcare professionals. Listening to the needs and requirements of users and sharing them with the manufacturers. We have influenced the development of apps, for example. We can't influence the hardware that goes into the wearable devices, but certainly the way in which they can be used by the older generation has been influenced, particularly with Samsung and a number of other people we've been working with. One of the problems is raising the profile of the usefulness of these devices in the older people, carers, and those people they are caring for. And that's actually been quite difficult. Many of these don't have the digital skills to enable them to use the devices properly, so there needs to be some way of addressing that problem. So providing evidence-based support to active ageing policies such as social prescribing and socialisation. So the key highlights of our research programme: we've raised awareness of the role of activity monitors in active and healthy ageing for older people and carers. Our research has shown that activity monitors can serve as behaviour change interventions towards healthier lifestyles. We have developed evidence-based strategies for older people and carers, how they can integrate activity monitors in their daily routines. We have informed the design of activity monitors and applications by involving manufacturers as one of the key stakeholders in research programme. And finally, we have disseminated evidence-based outcomes in our research programme to charities and policymakers for supporting active and healthy ageing and social prescribing policies for addressing socialisation and loneliness. But there are barriers. Barriers to adoption include matching the diversity of user needs and activities. Many of these devices don't record gardening activity, housework, wheelchair usage, although the Apple Watch does, but you have to download a separate app. The usability and access concerns the need to design activity monitors for age-related impairments such as vision, hearing, memory, and dexterity. I don't know whether you've ever got your first activity monitor, but it seems to be wrapped up in plastics in such a way that you probably need a hacksaw to get it open. And then the only instructions you have is a QR code. But that's no good for someone who's 80. None of that works. So the design of every single aspect, from the device itself to how it's packaged and how support education is managed, has to be addressed. So, so access of data, management and security concerns of data storage, digital health literacy skills at all points of the service delivery to the patient. We found that using Age UK, Milton Keynes, workshops for people who are interested in purchasing these on a regular basis, drop-in centres, saying this is how, we've got an expert who can help you out here. Those proved to be very useful indeed. And perceptions of healthcare professionals on non-medically certified devices. None of these devices are medically certified in this country, although I think the FDA in the States are thinking about 2 or 3 devices as being of medical quality. In other words, you can rely on the information they provide people. So the conclusion is they can be useful in the health and well-being of people as behavioural change interventions, in alleviating socialisation and loneliness in older people because they become parts of groups and they go out for walks at the same time and so on. The activity tracker to keep connected with family and friends. Many of these so-called carers were remotely caring, making sure that the person they were caring for was okay when they were at work, for example. The activity tracker being kept connected with family and friends. A sense of accomplishment by the users. This seemed to be something that came up even the 85, 90-year-old people took great pride in presenting us with their work. The use of data in diagnostics and medical interventions, that's going to become much more common. We are involved in several other projects looking at that. In pre-operative intervention, in post-operative monitoring of mobility during rehabilitation, for self-monitoring of specific medical conditions or monitoring by carers. We found that in one case, someone who had COPD took up the activity tracking, and over a period of a year, their COPD was was improved, should I say. So they were able to maintain what we consider to be a fitness level of someone 20 years younger. However, there were concerns about the accuracy of the devices and apps. So for further information, we've got the project website, publications and presentations are here, and email addresses are all these people's names with @open.ac.uk. Thank you very much for your time.
Thank you for the presentation. That was excellent. I'm really interested in, well, something you alluded to, I guess, on your last slide, but you were talking about this a little bit, about how this data is changing the kinds of conversations that doctors or GPs might be having with patients. And it struck me, although you didn't say this, is perhaps how are patients actually bringing this data to their appointments? You know, are they bringing on a device? Is it paper-based? Because I can't imagine how a GP can actually deal with all the different possibilities of data that might be coming at them with no sort of forewarning that they might be expected to comment on it. Like, I'm really interested in that sort of facet of the challenge.
It's either on the app or paper-based.
Yeah.
And if it's paper-based, what usually happens in the UK is that it's kept by the GP and it's scanned into their patient record. There's no other way at the moment of taking data and put it into your patient record as a digital signature. It's just not possible.
And so in your research, I wasn't getting a clear feeling of how the sort of GPs, if we use them as an example, were coping with this.
They have to be trained to cope with it.
Yeah.
Obviously, there's a communication problem about how you deal with people giving you more information than you possibly hope to deal with. I think the profession needs to look at this very critically.
Did your project make recommendations?
Yes, we made.
along
Yes,
those
we've got
lines?
recommendations for health,
Okay.
the health professionals. Yes.
Good, thank you.
What we haven't done is got as far as nice. That's the final hurdle, I think. We do have 3 posters in the atrium of the library, so we'll be around there at lunchtime.
Yeah, thanks, Duncan. This is a very useful study because the signals I'm getting, although perhaps you didn't say this, is that all the people who were involved in the study, of course, were doing this totally voluntarily, and there was an impact on their self-management of their conditions, and I guess a pretty universal feeling that they made a good decision to be involved in the overall study. But just to, and so often we are kind of hung up a bit on people kind of consenting and all the rest of it, and having to persuade people. But I guess it's because of the fact that Fitbits and things like that are relatively discreet. They're worn by people of all ages, so there's no stigma attached to wearing and using those kind of devices. And just one comment really about the concern about the health professionals, including GPs, about reliability and accuracy of data. 2 points relate to that, clearly. One is the fact that very often it's the trend data that's possibly more important than the accuracy or reliability. And I do recall, and I can't remember where it was, reading a study or a report of a study about 3 or 4 years ago, which testified to the fact that the equipment in the doctor's surgery, 20% of it is wrongly calibrated or inaccurate anyway. So that might be
including blood pressure monitoring devices.
Okay, well, fair comment. So some of those fears may be exaggerated, but certainly I do appreciate their dilemma of not wanting to be flooded with data because of issues around liability, should they not see or spot something in that data that could be of great importance in relation to the patient's medical condition.
Yeah, okay, so it wasn't really the object of our study to look at the reliability of the devices, but certainly that was of concern. What we did find out soon enough is that the devices that we were able to record heart rate or use pulse oximetry were actually more reliable in terms of monitoring cardiac function. As you might know how these devices work, but they shine light onto the skin underneath the device, and they look at the bulk flow of blood, and from that is integrated response, and the peak flow is then interpreted as each cardiac cycle. So that's how they look at heart rate. If that's combined with activity, it gives a much better impression of monitoring health than any other device.
Oh, sorry. Do you think with the devices like Fitbit applying to become medical devices, do you think that'll have a much better impact with them, going from being a wearable to being a medical device, impacting their accuracy?
Yes, so it'll only obviously be those that are accurate and can be trusted. Those perhaps that use secure protocols to download the data. I mean, it is possible to hack these devices quite easily. And that's certainly not something that, a hackable device is not something I'd recommend people use. But certainly, in order to get FDA approval as a medical device, you'd have to conform to certain standards, and they have to be agreed amongst the manufacturers. And that, I think probably those same sort of design requirements will be in this country as well. Yeah.
Right, thank you very much, Duncan. It just remains to thank our three speakers, Lucaa, Dorothy and Duncan, for three extremely interesting presentations this morning. We now